Have you been told that your anxiety or depression is simply a diagnosis to manage for life? What if that view is incomplete? The brain is a physical organ that can be seen, measured, and improved. In this message, we will follow the central promise of the end of mental illness. You will learn how brain patterns explain emotional suffering, why one treatment rarely fits all, and how practical lifestyle, nutrition, and targeted therapies can restore brain health. This book matters because it reframes mental illness as brain illness. Once the organ is visible and understood, recovery becomes precise, compassionate, and achievable. Why this approach changes everything. Psychiatry has historically relied on symptoms alone. Doctors listen to stories, apply diagnostic labels, and prescribe medication. That approach misses the organ itself. When clinicians look at the brain using functional imaging, they find distinct activity patterns that explain symptoms. Seeing the brain shifts treatment from blind guesswork to targeted care. This reduces trial and error and improves outcomes. The end of mental illness argues for a future where mental health care is as evidence-based as cardiology or oncology. SPECT imaging and clear evidence. SPECT is a brain imaging method that measures blood flow and activity. Over hundreds of thousands of scans patterns emerge. Low prefrontal blood flow links to poor focus and impulsivity. Limbic overactivity links to sadness and rumination. Temporal lobe irregularities appear in mood swings and dissociation. These patterns are reproducible and clinically useful. They explain why two people labeled with the same diagnosis may respond very differently to identical treatments. Imaging lets clinicians look before they prescribe and tailor interventions to brain physiology. The 4 circles of health. Healing the brain means treating the whole person. The 4 circles model organizes care into biological, psychological, social, and spiritual domains. Biological means sleep, nutrition, exercise, and toxin avoidance. Psychological means therapy, thought training, and behavioral skills. Social means relationships, community, and safe environments. Spiritual means meaning, values, and purpose. Strengthening each circle produces resilience. When one circle collapses, the others suffer. Small changes in any circle create ripple effects. 7 brain types with brief descriptions. Through clinical imaging, 7 brain patterns commonly underlie anxiety and depression. Each pattern benefits from tailored interventions. Type 1, pure anxiety. Overactivity in the basal ganglia creates a constant high idle. Symptoms include chronic nervousness, muscle tension, panic-like episodes, and excessive worry. Strategies include relaxation training, magnesium and B vitamins, regulated breathing, and therapies that reduce arousal. Type 2, pure depression. Excess activity in deep limbic structures produces persistent sadness and low energy. Treatments focus on sleep restoration, anti-inflammatory nutrition, social engagement, and therapies that lower limbic overdrive. Type 3, mixed anxiety and depression. Simultaneous activation of limbic and basal ganglia systems results in both worry and deep sadness. Interventions combine calming strategies, plus mood support and social reconnection. Type 4, over-focused anxiety and depression. Excess anterior cingulate activity causes stuck attention, rumination, and perfectionism. Improving cognitive flexibility through behavioral exposures, increasing serotonin support via diet or supplements, and training attention reduce rigidity. Type 5, temporal lobe anxiety and depression. Abnormal temporal lobe activity yields irritability, memory problems, dissociation, sensory distortions, and rage tendencies. Common history elements include head trauma or seizures. Treatment emphasizes omega-3 fats, anti-inflammatory diet, temporal lobe stabilization techniques, and trauma-informed therapy. Type 6, cyclic anxiety and depression. Marked episodic surges in limbic or basal ganglia regions result in mood cycling and severe premenstrual or bipolar spectrum features. Management centers on cycle stabilization with lifestyle regulation. Sleep consistency, mood-stabilizing nutrients, and medical oversight when required. Type 7. Unfocused anxiety and depression. Low prefrontal engagement together with overactive emotion centers creates brain fog, procrastination, and cognitive slowing. Interventions elevate prefrontal function through structured routines, exercise, targeted cognitive training, and stimulant-sparing strategies. Each type requires a different mix of nutrition, exercise, sleep, therapy, and occasionally medication. Imaging helps match therapies to the brain pattern rather than to symptoms alone. Brain injury, trauma, and hidden causes. Many people labeled with chronic psychiatric diagnoses actually have untreated brain injuries. Concussions from sports, childhood falls, or accidents may cause persistent mood and cognitive changes years later. Trauma leaves measurable brain effects as well. Identifying injury or past trauma changes treatment priorities. For injured brains, emphasis shifts to neuroprotection, anti-inflammatory nutrition, brain rehabilitation exercises, and careful pacing of cognitive work. Small interventions such as omega-3 enrichment, sleep repair, and vestibular rehabilitation can yield large improvements. Inflammation, toxins, and the environment. Chronic inflammation damages neural circuits. Modern diets high in sugar, refined carbohydrates, and industrial seed oils promote systemic inflammation. Toxins from alcohol, smoking, air pollution, heavy metals, and chronic stress further injure the brain. Reducing exposure while supplying antioxidant-rich foods repairs cellular function. Clinical research shows a strong link between elevated inflammatory markers and increased risk of depression. Lowering inflammation through diet and lifestyle correlates with improved mood across many studies. Nutrition and brain food. The brain is built from food. Nutrients affect neurotransmitter synthesis, membrane integrity, inflammation, and mitochondrial energy. Important food principles include nutrient density, omega-3 emphasis, and avoidance of ultra-processed items. Key foods Dr. Amen recommends include wild fish, leafy greens, nuts, berries, avocados, and extra virgin olive oil. Specific nutrients such as B vitamins, choline, magnesium, zinc, and vitamin D play outsized roles. Eating whole, colorful foods supplies the raw materials for neurotransmitters and cell repair. Sleep, exercise, and brain cleaning. Sleep is not optional. Deep sleep clears metabolic waste from the brain through the glymphatic system. Chronic sleep loss impairs memory formation and emotional regulation. Exercise increases blood flow, enhances neurogenesis, and raises BDNF, a critical growth factor for neurons. Even 30 minutes of moderate exercise daily produces measurable brain benefits. Combining sleep repair and regular movement optimizes recovery and resilience. The power of thoughts and cognitive training. Thoughts are biological events. Negative circuits reinforce themselves chemically. Repeated automatic negative thoughts create stress hormone cascades that shrink memory networks. Training the mind to catch and replace these thoughts rewires neural pathways. Practices such as cognitive behavioral techniques, gratitude exercises, and mindfulness alter brain activity and produce measurable gains on imaging studies. Small, consistent practice matters more than occasional grand efforts. Personalized prescriptions. One of the strongest messages of the book is that personalized prescriptions outperform one-size-fits-all approaches. A patient with low prefrontal activity benefits from routines, exercise, and cognitive training to strengthen executive control. A patient with limbic hyperactivity benefits from anti-inflammatory nutrition, sleep, and calming practices. Medication retains a role but should be chosen based on brain pattern, with close monitoring and integration into a broader plan. Drugs, supplements, and cautious use of medication. Medication can save lives and stabilize crises. The book does not discard medications. Rather, it argues for smarter use. When medications are used, they should be combined with lifestyle prescriptions and monitoring. Supplements such as omega-3, certain B vitamins, magnesium, and targeted amino acids may support recovery. All supplements and medications should be overseen by a clinician familiar with brain-based approaches. The importance of social connection and meaning. Humans are social animals. Loneliness and isolation are potent risk factors for depression and cognitive decline. Finding purpose, serving others, and belonging to supportive communities produce measurable neurochemical benefits. Interventions that rebuild relationships create safe routines and reinforce identity significantly reduce symptom burden, prevention, and public health implications. If brains are the organ of mental health, the same prevention principles that protect hearts can protect brains. Early life nutrition, head injury prevention, pollution reduction, and promoting healthy routines become public health priorities. Investing in child nutrition and safe environments reduces lifetime mental illness risk. The book calls for a cultural shift from symptom management toward brain health promotion. Case scenarios. A teacher with chronic irritability and impulsive behavior receives a SPECT scan showing low prefrontal blood flow and temporal lobe irregularities from past concussions. Her plan includes omega-3 supplementation, structured sleep routine, cognitive training, and therapy. Within months, her impulsivity reduces and classroom relationships improve. A college student with severe rumination and insomnia shows limbic overactivity and cingulate overfocus. He adopts sleep hygiene, removes processed foods, begins magnesium supplementation, practices nightly gratitude, and learns cognitive diffusion techniques. Over weeks, rumination subsides and sleep normalizes. These scenarios show how targeted plans match brain patterns and produce measurable change. Scientific support and research highlights. Functional imaging studies consistently show that activity patterns correlate with symptom clusters. Research finds inflammatory markers predict depressive episodes. Trials of diet and exercise report mood improvements. Neuroplasticity research demonstrates that repeated cognitive practice alters neural networks. Brain-based psychiatry synthesizes these findings into clinical recommendations. The goal is not to replace existing science, but to integrate imaging, biomarkers, lifestyle, and therapy into a cohesive model. Common misconceptions addressed. Mental illness is not moral weakness. It is not untreatable. Seeing the brain changes stigma. The book dispels myths that medication cures everything or that therapy alone is sufficient. Healing requires multiple levers. Individuals are not defined by their diagnosis. Brain health can be improved at any age with the right interventions. Practical starter plan. Begin with 3 concrete steps for the next 30 days. First, prioritize sleep. Create a nightly routine and aim for consistent deep sleep. Second, eat whole nutrient-dense meals, focusing on fish, greens, nuts, berries, and healthy oils. Remove ultra-processed snacks and excessive sugar. Third, move daily for at least 30 minutes and include strength and aerobic elements. Add 5 minutes of focused breathing each morning to lower baseline arousal. Track mood, focus, and sleep. If possible, consult a clinician trained in brain-based care to tailor supplements and check for head injury history. Takeaway challenge. Your brain is not beyond help. Small daily choices compound. For the next 2 weeks, commit to the starter plan. Note changes in mood, sleep, and clarity. Share one positive change with a friend and rebuild social connection deliberately. If you are on medication, do not stop it without medical oversight. Use this challenge to begin a durable path toward brain health. Thank you for watching. If this message helped you, subscribe for more science-driven summaries about healing and health. Visit 4 other books on brain restoration and emotional resilience.